Hi there, I'm Dr. Kelly Reese. I am a naturopathic physician and I own the Natural Medicine Center of Raleigh in Raleigh, North Carolina. A lot of people ask us, what is a naturopathic physician? Well, I have 5 years of medical school and I'm a very highly trained functional provider. What I mean by that is my main goal is to get to the root cause of why you feel the way you feel. Right now, we're facing an absolute pandemic of coronavirus, also known as COVID-19. But what are we learning here? What we're learning is that we need to be healthy before something like this happens. What are we waiting for? We can't simply supplement your immune system to avoid getting sick with a pandemic like this. So this has become a huge incentive to be healthy from the inside out. No more waiting. We need true immune strength because herbs and vitamins simply won't save us and get us out of this mess. My biggest concern is this may not be the last time we see something like this. So is your immune system truly ready to prevent something like coronavirus illness as we move forward? My biggest issue, biggest thing that I talk to with our clients is we must be proactive and not reactive. We're constantly finding that we are trying to catch up and build our immune systems later rather than before something like this happens. We're not being active in our lives. We're not eating properly. We are not taking health seriously until, as we're finding out right now, it's simply too late. One of my biggest pet peeves is I feel we are being conditioned by medicine, by the system, to just absolutely accept feeling poorly at any age. This was a Facebook post, and underneath this Facebook post, it said, "My doctor told me once I turn 40 to put the Band-Aid where it hurts." Well, simply, what does this imply? That at 40 years old, you're not going to be vital. You're going to be ill, tired, hurting, in bed at 40. Simply unacceptable. Our system is not helping us feel better. Our system is making us accept something that's simply not true, that we don't have the ability to feel good at any age. A very powerful image is this image of this banana. We spend so much money on our nails. We spend so much money on our hair, on our clothes, buy our big screen TVs. Yet when do we truly invest in our health? We don't. It's not common to invest in one's health. We are spending so much time working on the outside, where what we need to be doing is working on the inside. Because if we don't have health, we have nothing. You have nothing if you don't have your health. So we can put rhinestones on a rotten banana, but the banana's still rotten. Some potent antivirals. I get this question all of the time, especially in the past 2 weeks. What are some potent antivirals to fight the coronavirus? We have some wonderful products out there. Elderberry, garlic, zinc, things like that. But to be perfectly honest with you, we need to start well before we get ill. We need to prevent. It's most important to prevent the illness. It's so much more powerful to prevent the illness than try to fight it once we get it. Because our biggest problem is spreading this virus. It would be great to prevent it in the first place. Be one of those people that can actually stop it in its tracks. We're facing an absolute health crisis. The system is absolutely broken. It is not designed to help you or I feel good, be healthy, and move through life without problems. This is from Medicare, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life simply not considered medically necessary. If it's not considered medically necessary, insurance won't cover it. Insurance is not designed to get you healthy. Insurance is designed to treat illness. What we do at the Natural Medicine Center of Raleigh is we help you reclaim your health so that you don't have to worry about becoming ill. You don't have to worry about fighting these illnesses. We see people who come in to prevent illness, or people who are very chronically ill and want a better way. They want hope. And simply, we can provide that hope. There is an easier way. Being healthy is not difficult. It's just different. 90% of all diseases that we see today are chronic. 90%. Now that means there's 10% that are acute. So in a situation where you're in a car accident, insurance and the conventional medical way, the system is set up to help you. But in 90% of the cases, it's not. It's chronic disease. It is meant to manage your illness, not help you reclaim your health and feel empowered and healthy from the inside out. The unfortunate piece here is that we have absolutely wrong or lacking information. We have information that is incorrect with the coronavirus. We have information that is incorrect on what is going to be the thing to get us healthy. We're looking for that quick fix. So we're looking for the belly fat shaker. We're looking to crunch our belly fat away. Belly fat is a sign that hormones are off, that stress has taken over your body, that our diets are off. True immune health comes from a multitude of factors. It is gut health. It is hormone balance. It is absolutely taking your diet into a place that is whole foods, beautiful, nourishing, nutrient dense. But we have to look outside of what antivirals, what medication. Oh my goodness, if this system breaks down because of the coronavirus, we are absolutely in a dangerous place. We need to prevent the system breaking down by not being a burden on the system in the first place, because we have amazing health. We're able to fight disease. We're able to transform our lives and be as optimally healthy as we possibly can. One thing that I do not let our clients or potential clients ever talk about is age. There is no age you should feel poorly, and don't buy into the fact that this is being sold as the norm. We have people here who are in their 80s and 90s. They have not stopped to take in that, oh, I should be feeble and weak and in poor health just because of my age. Something that I ask all of our clients is, what is the reason you should be healthy? These are my reasons right here. My reasons for being healthy are my family. I strive to be healthy every day because of them. What is your reason? People outside of you need you to be in your best health and shape. Who are those people? Why do they need you to be healthy? They're depending on you. Maybe it's a spouse, a child, a parent, a grandparent, a sibling. Any of these wonderful family members, friends need you in their lives. Not just need you, but they need you in your healthiest state. Think about it from that perspective. Who needs you? Who depends on you to be your best self, to get down on the floor and play with them, to go on vacations with them? There are 3 types of negative stress that I consider. Physical stress. So we have physical trauma such as car accidents or contact sports like football. We're all seeing what's happening with the concussion syndrome that football players are getting. We have chemical stresses. Look at the viral stresses, the bacterial stresses that we're having right now. And then things that we think of, emotional stresses. All types of stresses. Stress will take your health down. It is very important to hear that again. Stress will take your health down if you don't find a way to manage it properly. We are inundated with stresses every day. However, we need to figure out how to manage that stress if we're to be truly healthy. Real food, something that I talk to and I hammer in with all of our clients. Real food is not the old food pyramid. Real food is exactly what you see on this picture. Your plate should be predominantly vegetables. We can't forget the fat that needs to go in our bodies. Fat is nourishing. Good fat, coconut oil, grass-fed butter, olive oil, avocado oil, things that we should apply liberally to our vegetables. Animal protein should be highest of quality, should be from local farms. And then fruits. Fruits are super nutrient dense. Our food should come from vegetables, fat, protein, and fruit. That is where our food should come from. That is what our plate should look like. 70% of your plate should be vegetables coated in fat. I don't mean dripping in fat, but I do mean glistening in fat. Fat feeds the brain. Fat nourishes our bodies. Fat helps us feel satiated. Fat helps us lose weight. Fat helps us even lose belly fat. So nutrition is something that we hammer in our clinic, that we want you to know what should you eat that is very specific to you. No two people should have the same diet. There's the keto diet, there's vegan diet. Which diet should I follow? There's paleo, there's low FODMAP. There is no one diet that we prescribe to each of our clients because no two people are alike. And hammering nutrition will help your gut be as healthy as possible. 70% of your immune system is right there in your gut. If you don't have the right diet and you don't have gut health, you don't have a good immune system. So we have to stop thinking of what supplements can I add to keep me from getting this coronavirus. We should have been doing that a long time ago. That's one way we help our clients get their absolute optimal health, is by having a really, really individualized nutrition plan. Outside of the coronavirus, we need to look at what other aspects of life are there that are keeping us susceptible, predisposed to catching illness, to not being healthy, to having pain, fatigue, just an overall sense of feeling ill, carrying too much weight, unable to lose weight. This is a perfect example. This test, which is TSH, thyroid stimulating hormone, this is, in my eyes, the most invalid test when it's used by itself. This is used so commonly to test for a thyroid disorder. And simply, this test alone cannot predict thyroid disorders, hypothyroid or hyperthyroid, over 50% of the time. It is misused and used as a single test. And our base test for thyroid, we run 10 tests so that we can better understand, as much as we can, what on earth is your thyroid doing. Believe it or not, thyroid is going to play a role in immunity. Thyroid plays a role in your weight or ability to lose weight or gain weight. Thyroid plays a role in how well you manage stress. Thyroid plays a role in your estrogen balance. Thyroid is crucial to be assessed, but it needs to be assessed more than a TSH. TSH is simply not enough. So many people go untreated for thyroid disorders because their TSH falls in normal category. However, if we looked at it more in depth, like the 9 additional tests we run, we see in so many of our clients, you have an overt thyroid disorder, but it just wasn't going to be picked up by running just a TSH. We've got to run more extensive testing. To get you healthy, we need to thoroughly test you. We need to run the right tests. This is some other examples of how we need to test appropriately. The top example is testosterone. So the testosterone test, this is more of male levels. And the testosterone, 200 to 800. I simply don't know a man alive who'd be content with having a testosterone level of 201. While it's in range and often just blown off in traditional conventional medicine, it is not adequate enough to give a man the feeling of ample strength or vitality. They will come in with low libido, feeling weak, not feeling themselves, not feeling vital. We need to have a better testosterone level for men and for women. It's a very vital hormone, makes us feel strong, makes us feel mentally capable. And oftentimes what we find is that the testosterone would be ample if it wasn't converting downstream to estrogen. So many times I see men come in who are on testosterone injections. Over and over, they're tested, and their levels keep staying the same, or maybe even they're decreasing. But they're not being tested downstream to see what's happening to that testosterone. Think of a sink with a drain. If you keep pouring buckets in that sink, and you look in the sink, where's the water I just poured in here? Where did it go? Well, let's pour 2 buckets in there. Well, where did the water go? Let's pour 3 buckets in there. If you're not testing or looking at the pipe leading from that sink, which is estrogen, you're never, ever going to understand the utilization of testosterone. So we test men and women for testosterone and estrogen, looking at how they are utilizing their hormones, not just what their frank hormones are. How are you using your hormones so that we can better assess how to get that hormone balance? Hormone balance is not about amping you up with bioidentical hormones or herbs to build up every one of those hormones. Hormone balance is finding where, how you're utilizing those hormones and correcting it downstream so we can keep that sink filled. The bottom picture is of cortisol. Cortisol is our stress hormone. Very important. Cortisol is crucial. We think cortisol is something that is making us unwell, but cortisol is our get up and go. It is our fight or flight hormone. If we test it one time, as you see in that top circle, we test it one time, and in blood, we are absolutely missing what is called the diurnal rhythm, or the rhythm that cortisol has throughout the day. It is 1, maybe 25% of the actual cortisol that you release throughout a 12-hour period. So you can see how inaccurate blood cortisol, one test, could be. We use urine testing, and we test 4 to 5 times over a 24-hour period so we can understand, are you fitting in the cortisol curve? Are you finding that we have ample cortisol throughout the day? If you have poor sleep, maybe your cortisol is going too high at night. Poor sleep equals poor immune system. If we don't correct sleep, we don't correct your immune system. If we don't correct sleep, we don't help you lose weight. If we don't correct sleep, we don't help you deflame and feel fantastic. So you can see how all of these hormones play an immense role in hormone balance, not just amping you up in bioidenticals. The why versus the what. In conventional medicine, they're looking for the what. You came in to see me. What diagnosis can I give you, and what prescription goes with that diagnosis? For example, blood pressure. You have high blood pressure. Here is the medication that goes with that. That is a what. But the why is more important. That's what functional medicine gets to the root of. The why you have blood pressure. Maybe it's a food sensitivity. Maybe your muscles are tense. And believe it or not, if your muscles are tense, your artery muscles are tense. And that means the blood has to push harder, have greater pressure on those artery walls as it tries to make its way through. It increases the pressure of the blood, increased blood pressure. If we don't remove the causes, we can't fix the issue. So you can understand, if we're not asking those right questions, we're never going to get the right answers, and you'll be on medications your whole life. And with some medications, then we layer on more medications and more medications. We help so many clients get off of those medications. Responsibly, slowly, we help clients who want to get off medications not be dependent on medications anymore. What we provide in our clinic is what we call health independence. Our main goal is to help you learn. We look at this as more of a curriculum. So we teach you how to fish, rather than giving you a fish. We want you to learn what makes you tick, what made you inflamed from hormones, from food, poor detoxification. Detoxification is an enormous player in health. Our liver is our main filter of our body. So if we're not cleaning our filter, it's like never getting an oil change for your car. What's going to happen? Your car simply isn't going to run forever. If we don't detoxify your body, we can't balance hormones. We can't heal guts. We can't help you deflame and see why you weren't well in the first place. So detoxification, we have to put all these pieces together to help you reclaim your health. We all can do it. There's not a person out there who can't reclaim their health. Our oldest client is 91 years old. He hasn't bought into, I'm too old to feel healthy. He is absolutely reclaiming his health, decreasing his pain, improving his vitality so he can continue to move forward in his life as healthy as possible. You have to treat the whole person, and it has to be a clearly defined path. So in our clinic at the Natural Medicine Center of Raleigh, we have what we call 6 stepping stones, because we have to have a system. If you don't have a system, we can't help you get on the right path. You can't do it easily. Our clients say all the time, can't believe how easy this was to get better, to feel amazing. And we have to do that with nutrition. I said that earlier. We have to hammer out nutrition, but it must be individualized for you. No two people are alike. Therefore, no two nutrition plans can be the same. We have foundations that we feel are really important. A big foundation that I feel is important is gluten-free. I think we've ruined gluten. I think if you find, even organic gluten is being found with residues of Roundup, the herbicide. So we are being poisoned when we eat gluten. So nutrition is crucial. Then we have to detoxify. We have to detoxify the liver. Everyone needs a detox. People get scared of detox. They think this is going to be difficult or depriving or restrictive. However, the first month of our wellness programs, the results we get with clients are amazing. Increased energy, decreased pain, decreased weight, just feeling deflamed, balanced, together, feeling wow, in 4 weeks, I could get on the right path. Once we have a clean slate, then we need to work on gut healing. As I said earlier, we can't have a potent, strong immune system if we don't have gut health. But we can't have gut health if we have livers that are clogged and not working properly and our nutrition is off. So to have all of that, we need to layer the right steps and then add gut health. We need to heal guts. So many clients come to us because they have SIBO, small intestinal bacterial overgrowth. But what I have learned over my 16 years of experience is that you can't just treat SIBO without treating the adrenal glands, without detoxifying, without balancing hormones. There is no such thing without working on nutrition. There is no SIBO diet that's going to heal you. There is no herbs that are just going to fix it and it's going to go away. We need to help heal the gut. We need to have that nutrition. We need to detoxify. We must balance hormones. The gut and the hormones are intimately connected. You cannot have gut health without hormone balance. You cannot have hormone balance without gut health. You need to work on these like a wheel that has spokes. Oftentimes we go to a doctor to work on one issue with a specialist, say constipation. You go to a gastroenterologist. You're working on one spoke to address that constipation. But what if that constipation is due to thyroid, hypo or low thyroid? Here you are working on it from a gastro or gut standpoint, but we've missed the hormone standpoint. You can see you need everything to help you get true health. So now we have nutrition, we have detoxification, we have gut health. Now we pull in the hormone balance. And we get nowhere in life without managing our stress. We all have stress. I don't know a person alive who doesn't have stress. However, without learning how to manage your stress, how do you cope with it? You won't get healthy. We won't be able to reduce your stress to nothing. We can help you find coping mechanisms. We do health coaching team members who help with helping you to absolutely manage and understand how to cope with your specific stresses. How do I manage my stress? How can I get through this time? Whether it's grocery shopping or your belief system in can I even heal? Or menu planning, we help. That's our whole goal, is to make sure you are supported in every way we can help you. So management of stress is crucial. And exercise. We've got to move our bodies. We have to move our bodies. This sitting is now considered the new smoking. We have to move our bodies. It balances hormones. It helps our guts move. We have to have better posture. Poor posture, hunching over. We don't digest our food well. Our adrenal glands, our stress glands can't work properly. Our hormones can't be balanced if we're all hunched over. So posture is an enormous piece. So 6 stepping stones, 6 pieces to your puzzle so that we can help you get on a clearly defined path to optimal health. Hopefully, this is helping you see that you can change the future of your health. That should be a resounding, yes, absolutely. You need someone who knows how to order the right tests. 16 years in practice, I've learned a lot. I'm constantly still learning. But ordering the right tests so that we can better understand why you feel the way you feel is our expertise. We must be proactive. We live in a very reactive society. We must be proactive. We must address these issues before they come. There will be new issues down the road, new viral hits to our immune system, bacterial hits. We had swine flu, we've had flus, we've had SARS. Now we have coronavirus. Don't think there won't be another one. Will you be ready? Will you be proactive, or will you still be reactive, trying not to get it, or trying not to get it in a way that will send you to the hospital? We have to look at the cause of our health issues. Why do I hurt? Why do I have high blood pressure? Why do I have high cholesterol? Why can't I lose weight? Why am I inflamed? Why are my hormones not balanced? Why do I not have a good mood? We have to focus on that cause and not the symptoms. We don't want to alter it with drugs, but we don't want to alter it with just supplements either. Too many functional providers, in my eyes, get this wrong. You get sent out with your shopping bags full of supplements. I can't supplement you to health. This is much bigger than that. I cannot supplement you to health. I use supplements to correct imbalances, but I simply can't supplement you to health. So I would think twice about spending the thousands and thousands of dollars on a doctor who is sending you out of their office with bags and bags of supplements that will only burden your body further. We have to correct those dysfunctions, those underlying dysfunctions. Have to look at your body as a whole. You have to understand. We have to be addressing all those pieces, like I was saying, so that we better understand how to get you healthy. Has to be systematic. It has to be a doable approach. And our passion at the Natural Medicine Center of Raleigh is to mentor you. We give our personal cell phones out to every client that we accept into our programs. We are simply unable to accept everyone who wants to work with us. We are only able to accept people who are absolutely ready to change their lives. No questions. They are ready to move forward. Tell me what to do. Guide me, mentor me, help me get on a better trajectory, because right now, this is where I think I'm headed. I think I'm headed in a really bad place. 3 to 5 years, might be in a wheelchair, be bedridden, be stuck in my house, be 50 pounds heavier, be super fatigued, not wanting to go hike with my husband or wife, play with my grandchildren because I hurt too much. Let's change your trajectory. But we do that because we work in what we call real time. We are available for our clients all the time, 7 days a week. Clients can text me personally 24/7. I'm not able to answer that text 24/7, but I do answer it 12 hours a day, 7 days a week. That is my commitment to our clients. That is our team's commitment to our clients, that we move you forward in real time. So you're not waiting from visit to visit to get answers to your questions. Can I eat this? I'm not feeling that great today. What should I do? This came up. And those questions are answered so that we can move you forward in a quick way. But most importantly, we're able to teach you so that you have health independence. We don't want you to need us forever. You shouldn't need us forever. You should learn everything we can to teach you. You should learn so that you can do it on your own. We're always here to help, but we like our clients to be very independent of us. Tell me, I may remember. Show me, I will remember. Involve me, I will understand. This is crucial. If we involve you, if you are part of this process, you will learn. You will take this knowledge and it will be with you for the rest of your life. So when down the road comes another viral attack, you're way ready. You already have a gut that is very balanced, hormones that are balanced. You know how to eat for your health. You know how to manage your stress to the best of your ability. We want to help you, but we want to help you learn how to help yourselves. It's time to stop procrastinating. I think a lot of people are recognizing this over the last, you know, 2 weeks to a month with the coronavirus. It's time to stop procrastinating, putting your health on the back burner. Tomorrow never comes. It's time to get your health under control today so that we aren't putting a burden on this system that is designed only for acute care. We would love to help you. What we offer anyone who's interested in working with us, we do remote virtual appointments so that you don't have to come into our clinic. We can work with you through Zoom, through FaceTime, so you can be in the comforts of your own home. You do not have to go to our office, leave, and we can still help you. We ship anything we need to our clients. We work with people all over the country very successfully every day. So we would love for you to give us a call to schedule your free 30-minute discovery call with one of our team members so that we can understand where you are in your health and where do you want to be. Let's set some clear goals and understand where you are, and let us build that roadmap for you to help you get the health that you deserve. You deserve optimal health, but time is of the essence, and it's time to simply stop waiting. Let us have the opportunity to help you to see if we can accept your case and work with you to reclaim your health. I thank you all so very much for listening.